Today, then the 7th day in the month of April 2022, I say welcome to the issues. You check your time, you say it's 17 minutes past the hour of 12. And of course, I'll be your host for today on the show. Adebambo Okpayemi is the name. And I'm not alone in the studio today. It's actually a full house. When I say a full house, I mean it's a full house with mothers. Not just mothers, but loving mothers, professional mothers that are so good at their game. I have doctors, pharmacists, and deputy directors in the studio with me today as we focus on another healthy conversation this very beautiful afternoon. A special thanks, of course, to Ikorodu General Hospital, always doing justice to good conversations every Thursday on IKD 106.1 FM. Of course, do not forget that you can listen to us all over the world via our website www.ikd1061fm.ng. Today the conversation is actually very bogus. It's so lengthy, so we'll dive into the conversation without wasting much time. Today our topic happens to be health and health-seeking behavior of people in a rapidly growing community, as today happens to be the World Health Day organized by the World Health Organization. 7th of April every year has been set aside for us to recognize our health situations and of course stay conscious when it has to do with health. That is why with me in the studio I have the privilege of introducing to you Dr. Ireti Dada, who happens to be the Principal Medical Officer, Ikorodu General Hospital. Dr. Dada, I say good afternoon to you.
Good afternoon.
It's good to have you in the studio.
Same here.
All right, with me also in the studio, I have pharmacist Omolade Adekola, who is also going to do justice to good conversation. Good afternoon to you, pharmacist.
Good afternoon.
How are you doing today?
Very well, thank you.
You're welcome. Of course, I still have the Deputy Director, Nursing Service, that is DDNS, Bilikis, Anifowoshe. I say good afternoon to you, man.
Good afternoon.
How are you doing today, sir?
I'm okay, thank you.
I must say it's good to have you beautiful mothers in the studio, and I would like us to jump into this conversation real quick. This year has been set aside, every 7th of April it has been set aside for World Health Day, and the theme for this year is Our Planet, Our Health. So I would like to come to you first, Dr. Ireti Dada. When we talk about the topic for today, health and health-seeking behavior of people, what do we mean by health-seeking behavior? Let that be the first question for this afternoon.
Thank you. Health-seeking behavior is any action or any action that a people or a person takes when they perceive they are not feeling well. When you feel you are unwell, what actions do you take or what inactions are taking place to seek remedy for what ails you?
So it has to be about the actions you take, the way you behave to all of these things. That is
care.
To get care. Oh, okay, that's great. You know, most of the time, some people will just tell you that. Sometimes some will tell you that if I'm just sick, don't worry, I just need to just relax, hold on, and I'll be fine again. All of that can be said to be the behaviors.
That's the kind of behavior. Yes, that's inaction.
That's great. Okay, that's the voice of Dr. Ireti Dada, the Principal Medical Officer, Ikorodu General Hospital. So we'll look at factors real quick, and there are still other questions that I would like us to focus on. But then I would like us to first off consider the factors of this and what are the factors that influences this health-seeking behaviors. Let us start with the factors.
Okay. Part of the things that can affect a person's health-seeking behavior is how they perceive, how they are feeling, their health. Now, it's not only when you are feeling unwell that you should actually seek for care. Also, you can prevent or optimize your health by seeking for health. That's we say that prevention is better than cure. So whether you are ill or you want to maintain a healthy level of your health, it's health-seeking behavior comes to play.
Okay.
So part of these factors that will affect this is information. You have information. Now you know, okay, there's a lot of illnesses around, but you might not be sick presently, but if you go to the hospital to be checked, then you'll be able to know if there is something that is in your system but is not yet showing up, and then you can seek help for this. And a lot of times when we seek help early or we check up ourselves, regular medical checkup, then you prevent these illnesses from coming and you maintain a good health status.
Health status.
Yes.
Okay.
So information is part of the factors that affect our health-seeking behavior. Socioeconomic status.
Okay.
people they know that they are unwell and they know that they should seek for care. But maybe if they don't have the money, they feel, oh, it will cost me a lot to seek for help. They will seek help to the level of their financial capability. It's not as if they will not seek help in some cases. It's not all the time that people sit down at home. But depending on how much they feel they have at their disposal to care for their health, they might decide to either go to the hospital, go to the pharmacy, call a nurse, or somehow take local herbs. So another factor can be age.
Age.
Yes, usually children cannot speak and they cannot go themselves to take care of themselves. We have elderly ones also, they cannot take care of themselves, so they have to depend on other people to take care of them. Also, social status.
Okay.
Like some people will not go somewhere to seek for health care because they feel, no, I'm above this level, or, oh, I don't have the time to go and sit down and wait for a doctor or a nurse to come and attend to me, so I'll just go and get some drugs myself. That's also a kind of health-seeking behavior influenced by your status. Also sex, your gender. A lot of women are known to seek health care, even though some might have some limitation. They are independent. They have to depend on their husbands. But
True.
A lot of women come to the hospital more than the men. At least come early when they perceive they are not feeling well, than the men that will keep on trying to be bold about it. And
I'm
say,
a man,
oh,
I'm a man.
Yes, there's nothing it will go until, unfortunately, it might get worse.
All right. Thank you so very much, Dr. Ireti. If you're just joining us, it is still the issues on IKD 106.1 FM. Today, we look at health and health-seeking behaviors of people in rapidly growing community. Whether we like it or yes, so many persons are taking their health for granted these days, and that is why World Health Organization has decided to set a day aside like this for the World Health Day, so that you can be conscious and aware. I'll come to you, Pharmacist Omolade Adekola. Most of the time, when we talk about health-seeking behaviors, one of the things people do around these days is actually very common. If they just have the symptom, they start feeling this headache, body pain and all, they don't even feel it's necessary to go to the hospital. They just feel like there are some drugs I can just take and treat myself. This is one of the health-seeking behaviors. Just like the doctor has given, she has talked about information, socioeconomic status, age, we have the sex, gender, and also I'll come to you as a pharmacist. Those kind of persons that decide to treat themselves with some kind of drugs that they feel is best for them. What do you have to say about this as a pharmacist?
Thank you very much.
Yes, please.
Okay. Developing on what Dr. Dada said. So you see, the world is rapidly changing. I mean, we are going into the technology age, and then the topic which is also saying that the community, in a rapidly developing community.
Yes.
We find people self-medicating. That is exactly the scenario.
Exactly.
They just self-medicate. I have a headache, and I just think that, let me just use this paracetamol. But it's, well, I wouldn't say, you want to be sure that you're actually very sick if you use paracetamol. But, as the Yoruba adages say, when we listen to the radio every day,
exactly.
So, we encourage people to try as much as possible not to self-medicate. Because it's just a headache, yes, but you can never say what the underlying factor that's causing the headache is. So, you walk into a pharmacy and then you just tell them, I have a headache, I have not been sleeping well and all that. Normally I would tell them, especially if it's a community pharmacy, I would say, have you gone to the hospital? But as Dr. Dada has said, these factors that inhibit us from going to the hospital, they waste the time in the hospital, I'm a man, what am I going to do in the hospital? I don't have enough money to go to the hospital. So we advise and we say, look, at least go. When you get there, you would know what they would say. It's not going to help you. This is your health. And
True.
then it's important to you. They're not going to give you, reel out a whole stuff of medication for you to use. But they would actually tell you, once you see the doctor, they will tell you what to use. And then they will give you the appropriate drug. If you need to run a test, they will tell you to run a test. And then they would give you the appropriate medication that is going to suit your situation. So we advise people not to self-medicate, not to just take what my friend is using. Just coming in here now, I just heard someone say that she hasn't been feeling well and this is what she uses and this is what she does. And somebody was telling her that, how do you use this for this? I mean, you're just using anything, any drug. So drugs to are poisoned indirectly if not used in the correct way. So it is advisable to definitely still go to the hospital.
Okay, you've heard it from a pharmacist saying that it is very much advisable. That is the right thing to do. Today, I will still say it over and over again. It's a day set aside to help us have consciousness, to stay conscious about our health, our well-being as a person. I'll come down to you, DDNS, that is the Deputy Director Nursing Service. Now, for a day like this that has been set aside, Doctor earlier said that most of the persons that come to the hospital are always women, while the men have this mentality or mindset that I am a man, this man factor thing is in their head. Now, I want to ask you, by your profession, is it to say that the women are more prone to sicknesses, diseases more with what we see these days, or is just that women just feel like I should always go, let me just go and disturb them at the hospital?
No. It's not that the women are more prone to the diseases. The issue is women are more caring. We are naturally caring. So we don't take things for granted, especially when it comes to health. That is why you will see that most times when a child is sick, even when the husband is sick, it is the mother or the wife that runs around to do so many things. So it's not as if they take it for granted, and they are more equipped when they come to the hospital, because they are the ones that will be there when you are giving the health talk, you are teaching them, you are encouraging them. They are the ones that knows more. That is why even when they are sick, in some cases, part of the health behaviors is that people will now run to women to ask questions, because they know they serve most of the work that others are supposed to do. They do more of it. They listen. They go around to get more information. They are well informed more than men. That is the reason why you see them around most.
All right, I'll take that. For you to say that women are more informed, I would have loved to argue that, but no problem. It's fine. You are using the woman power now on me. There's no problem about that. It's okay. Okay, so let me come down to you, Doctor. Part of the factors that you mentioned earlier, you talked about information, you talked about socioeconomic status, you talked about age, and then you talked about this social status. I am more concerned about the age, where you talked about the younger ones and even the older ones that do not have the opportunity to speak up. Let's focus more on this. People that are in this circle, the young ones, the children, and the older ones, what is the way out for these ones? Because they need to be taken care of as well. Their health is also important.
Yeah. So communication. When you okay, let me start by saying information. Now, when a child knows that when I'm not feeling well, I should get a form of care. So communication. You speak out. Speak out to your caregiver, speak out to your parents. And then you know that the hospital is also open for you, especially government hospitals. Even children, I mean underage, I'm not talking about very young children now that cannot even move around themselves.
Okay.
I'm talking about young people below the age of 17, 18. If you get to the hospital, you have people there that will listen to you and assist as much as they can, and they might help you to communicate with your caregivers. So communication, speak out when you are not feeling well, so that whoever can assist you to get care. For that health.
So communication is the major thing to consider, because if you're not speaking out, nobody would attend to you. So pharmacists, let me come back to you now. When we say pharmacists, we talk about the drugs, we talk about medications and all. Is it right to say sometimes some who come to the hospital is a little bit similar to what I asked you earlier, but in a way it's quite different? Some would tell you that this is the kind of sickness that I have. Some will even go as far as telling you that in my family, this is the kind of sickness we go through, and this is the drug we use. Sometimes some doctors will prescribe this particular drug, so they don't feel the essence of going back to the hospital again to go through the same process. Just like you said, they will tell you hospital is stressful. What do you have to say to people like this?
Thank you. I would still advise, it is necessary to take your doctor's advice. Now, if I'm going to put what you said in another order,
okay,
they come and say, oh, this was what was wrong with them. They had seen the doctor, so they just want to buy more of that particular drug.
Exactly.
So we tell them, what is wrong with you? Has it gone? Or you just want to treat it again, or you just, they just don't know the reason why they are in the hospital. They came to buy the drug again. And we tell them, okay, if the dose is finished, see your doctor again. And let them ascertain that you still need to continue it. That is one form of drug abuse, because the medication has not been written for them again, but they want to continue because it has solved the problem. So when something else comes up again that looks like what was wrong with them before, they want to continue that medication. So we try to advise as much as possible that you see your doctor again. What you think is wrong with you might not be the same. It might be something else. So that they can ascertain that this is the medication you need, or they're going to give you something else. And then we also let them know that when you take that particular medication for too long, it stops working when you don't need it. So when you actually need it, it doesn't even do anything.
Wow.
And then they have to go through the whole process again.
Over again.
As in going for tests, everything that's going to cost them money. So we advise, use your medication for the period it has been prescribed for you, and make sure you finish it. That's another thing. You tell people to use drugs for 7 days, they use it for 3 days, I feel good, and they leave it. So that's it. So we tell them that finish it for the duration it has been written for you. Definitely you should feel better. Some people are even told by the doctors that when you use it for 3 days, come back, run a test.
And be sure.
And they want to be sure of some other factors, and all. Then continue. Or they might even change it after that 3 days. So at the end of the day, coming to the hospital is safer than being sorry.
Okay. All right. Thank you so very much. I'll come down to you, Doctor. But if you're just joining us, it's still like 8106.1 FM. I would perhaps open the phone line. 0904-081-1061 is the phone line. 0904-081-1061 is the phone line where you have the opportunity to speak to either our doctor, our pharmacist, or the Deputy Director, Nursing Service. So, Doctor, I come to you now when we're still talking about our health. Now, it's... Okay, let's quickly take this call. Hello to you. Good afternoon. Your name and where you're calling us from real quick. Can you speak up a little bit? I can't hear you. All right, you can call us back on 0904-081-1061. 0904-081-1061. Doctor, I know General Hospital Ikorodu, when it has to do with a day like this, when tuberculosis had their day, there were things that were set aside and other days like that. So today being a day like this for our health, what are the plans set aside by Ikorodu General Hospital and perhaps the government?
Okay, so for government on all levels, we are various health institutions. We are doing something like this.
Okay.
Coming out, give information to people. We are also talking to our patients in the hospital, giving health talks, which we do from time to time, but now we particularly pay attention to our health so that they can also take the information to those people at home. And we tell them how they can influence the health-seeking behaviors of the people around them. Like, I have been given this kind of drug to use. You don't go and give it to another person when the person complains of something that looks similar. Let the person also come to the hospital, because let's give headache as an example. I might have headache. It might be from malaria. It might even be from high blood pressure. So if you just take paracetamol, it might not work for you. What works for this person will not work for you, because this is not the same things, same thing that is wrong with you. So we go out, talk to our patients, give awareness of health and how they can assess health care for whatever illnesses they might have. And let me also say that it's not only when you are ill that you should come to the hospital. This is a part of the information that we are passing across to the community, that don't go to the hospital only when you are not feeling well. Come even when you think you are okay. Be checked so that you will know that yes, you are feeling well and you can maintain this level of your health.
All right, thank you very much. Let me come down to you, Mrs. Anifowoshe.
Yes.
One of the persons that are actually very vital and they need so much care are our nursing mothers. And these are the people that yet still take health care for granted, especially those that have had a kid or two before. They'll just feel there is no need. Motor first born me, I did the same for my second born. So I'll come to you because I know you're more in line with this kind of persons. What are your words to nursing mothers that are out there that take health issues without serious, cogent way of life. Their behavior when it comes to health is nothing to write home about. What do you have to tell people like this?
Thank you very much. As per the nursing mothers,
Yes.
our health education to them starts from the time they are still when they come for antenatal clinics.
Okay.
During the antenatal clinics, we teach them on so many ways, so many things to do before and during and after delivery. And we also let them know, once you have your child, when you get home, you will find other different doctors at home, which are Muslim women anyway. So that will be teaching, that will be telling you some other things apart from what you are taught in the hospital. So we tend to discourage this. We discourage them from listening to such. That if there is any problem when you get home, it's better you come back to the hospital. We let them know the lineup of medical services that are available for them and their children and their babies rather. So that if any of such thing happens, any problem happens, they have to come, not doing what they are doing at home, because you find out that even when it comes to issue of immunization, you must have educated them very well before leaving the hospital, so that they will not now go back home and the one old mother will be telling them, please, they don't need it, all this one, we don't do it in our own time. So once they are well equipped and they are well encouraged on what to do at the right time, I don't think they should fall victim. And some of them that even fall victim, we still accept them, we treat them, and then educate more against another time.
All right. Okay. Thank you so very much. IKD 106.1 FM 0904081161 is the phone line. I see the calls and I'm going to be taking all of that. 0904081161. Do not forget that you can also join us live on Facebook and Instagram. Perhaps if you decide to see the beautiful faces of our mothers in the studio, you can see that on our Facebook and Instagram page at IKD 1061 FM. At IKD 1061 FM. And of course, you can hear us from all over the world. www.ikd1061fm.ng. So I come back to you, pharmacist. You know, the reason I will keep coming back to you is because you people are the ones that keep giving all the drugs and keep prescribing. You know, so when all of this prescription comes, there are sometimes we see some drugs now. I want us to go down to this conversation. There are some drugs that they will just write and write. And some people will just tell you that I can shuffle and it's working for them. In this kind of case, take for instance, I've been prescribed about 4 different drugs and I'm going out to buy them and I discover that one is about 5,000 naira and I don't have up to that. I bought the other 3 and I used it. It worked for me. Do I still need to buy that other one? But let's take this call first. Hello.
Hello, good afternoon.
Good afternoon. What's your name, please?
Thank you very much. Let me say anonymous. IKD 106.
Okay.
Good afternoon to our guest in the studio.
Good
I would like to direct my question to the pharmacist.
Okay.
Particularly to drugs that come to Nigeria. It's clear that as it stands now, the World Health Organization has, to an extent, granted Nigeria, a kind of a path when it comes to manufacturing drugs and other ways to help to improve the lifestyle and health of people.
Yes.
But my question that I want to ask is, on the drugs that we have in Nigeria, what measures have been put in place, to have good drugs, viable drugs that will help us to fight against certain sicknesses, ailments that we go through? Thank you.
Thank you so very much. Thank you for that question. Maybe we should attend to that one real quick while he still wants to get his response to that. I think his question in short is asking what are the facilities that are made available to get good drugs in Nigeria today?
Okay, thank you. Basically, well, a lot of drugs are imported into the country. And first things first, they have to go through NAFTA. Meaning that they have to be tested and then they have to be ascertained good for it to be consumed by the population and all. So first things first, once for anyone to even bring drugs to the country, you have to be registered to do that. So that's first things first. It's a registered person that has to bring drugs in. And then once it comes in, it has to go through the normal checks. It goes to the NAFDAC office. They test it. They make sure it's efficacy and everything about the drug is okay before it can be allowed to be consumed by the general populace.
Okay. All right. I want to believe that your question has been attended to that anonymous person who called in. The question I was asking, maybe I should break it down very well because I'm trying to avoid a particular word. But this is it. Some people would say that our doctors will just tell us to go and buy some drugs that we don't even need. They just want to waste our money. Is there anything like that? And that is why out of 4 drugs, they will decide to buy just 3. And they'll still tell you, Sherry, you see, it not even worked. So why do I need to buy that one of 5,000 naira? They just want to waste my money. What do you have to say to that?
That's what they think.
Okay.
I would always say that. That's what they think. But if 4 drugs are written,
Yes.
it's very, very important. They are the ones that, it's the patient that made the complaint to the doctor. And the doctor has examined and seen that, oh, okay, you need this, you need this, you need this, you need this. Yes. So it is very important that they should buy everything. You know, there are some particular conditions in which if one drug is not available and you don't use it with the others, you think you feel better. And then when the particular situation relapses, then you know you're not better at all. So we tell them that if we don't have it and they have to go and buy it outside, we tell them that before you begin to use them, make sure all the drugs are complete. If not, it won't work. You will only think it's working, but it won't work. And then you will relapse and have to come back again. And then the situation might be worse. You might have to be admitted, you might, and all those things. So we encourage people all the time that, look, buy all your drugs. Even if you buy them, it's different to buy. Use all of them as it is said to be used. If you tell you to use this in the morning, use it in the morning. And with the theme of the World Health Day, the whole information, as Dr. Dada has said.
Yes.
I want to also encourage people to listen when they come to the hospital. Everybody's always in a rush, They get to the doctor, they've spilled it all out, and then the doctor has given them what to do. And then they come to the pharmacy and say, they've been here since morning. So they're not listening to what we're saying. They're not listening. So they take their medication, we are explaining to them, then they go. When they get to the gate, they say, they come back.
Exactly.
So, it's two-sided. Help me, help yourself. So when we are telling them what to do with their medication, it's very important they listen and use it appropriately. And also take care of themselves in the health-seeking behavior. Health-seeking behavior is about taking care of yourself.
True.
It's not always you have to come to the hospital. If you take care of yourself, you won't even have the need to come to the hospital. Use your drugs appropriately. Eat good food. Hygiene, very necessary. I mean, we're just getting out of COVID. These things are very, very important.
All right, thank you so very much. So I would ask, when it has to do with money, what happens to the average Nigerian person? Is it really a factor? Is money really a major factor to getting proper, adequate attention in a medical hospital in our present situation? We are talking about our fast-growing community right now. Is money a major factor? Because this is one factor that is carrying a lot of people away from our hospitals.
Thank you. Yes. I would say yes, money is a factor. Because without money, there is nothing anyone can do. And even though it is a major factor, it is not as important as being alive. So for us to remain alive, one way or the other, when you are seeking for health service, you are seeking for to be healthy,
Yes.
you just have to get money. But in the government hospitals, we don't take money as a priority when you come to the hospital, especially when you need to be admitted. We do not wait that until you pay, until you get the money to pay. That is when you will be attended to. No, we don't do it that way, because we know money is second to being healthy. So for that reason, it is even better to seek health earlier than falling sick to the extent of looking around for money. Seeking good health earlier is better. You listen to like a program like this, you want to listen for preventive measures as well. When you are able to take up the preventive measures, you will find out that you may not even need to come to the hospital, talk less of spending unnecessary or unnecessary spending. So for that reason, money is a major factor in every part of life. Every part of life, money is a major factor. But the best way of maintaining your health is be on the preventive, comply with the preventive measures, seek for help earlier, so that it will not get worse for your people or yourself to start looking for money to save your life.
Thank you so very much. I think I am so much in love with that which you just said. Doctor, before we round off and call it a day, there are so much that you have to tell people out there. But from your own medical angle, what is your advice? Today we are celebrating and putting consciousness in the minds of persons out there. As a doctor, what do you have to tell people that are out there and how they should always ensure that they take care of themselves?
Thank you very much. Like we have been saying and like we all know, it is better to prevent than to fall ill. So don't wait until you are not feeling well. Go for regular medical checkups. It costs less because you would avoid complications. Because if you come to the hospital when you are in crisis, then you spend more. That is when you will need to be admitted. But supposing you had come and these things had been picked, maybe your blood level, your blood pressure was at a mild level, you just take drugs and go home. But when it becomes a stroke, when it becomes a heart failure, then you have to be admitted. Then you will spend more. Then your people will lose economic power. They will lose time, yourself and your caregivers. And this is very stressful on you, on the community, on our economy. So what I advise our people is that come to the hospital to check up yourself before you fall ill.
Thank you so very much, Doctor. I come down to you, our very own pharmacist. Your word of advice, your parting words to every person out there listening to your voice in Lagos, Nigeria.
Okay, my parting word would be we should take our health seriously all the time. I mean, we can't get enough of good health. So in everything we're doing, we should be very, very conscious of our health. Eat right, sleep right, and I guess we'll be fine.
All right. You've heard that. Eat right and sleep right. And of course, whether you like it or yes, you will be fine. That I also want to believe. Deputy Director, Nursing Service, I want to say thank you so very much. The theme for this year is Our Planet, Our Health. What do you have to say to this in explanation?
Our planet, our health. Yes. This also goes with the seeking health earlier, having a good health behavior, because it is only people that are healthy that will remain alive, and it will make the whole world alive as well. So for that reason, seeking health earlier before you fall ill, as my doctor just said, it is better than allowing health or complication to set into your matter before then. So to remain healthy, for the community to remain healthy, for the whole world to remain healthy, we have to seek help earlier. We have to seek for help earlier. We have to follow the preventive measures. You have to come to the hospital regularly. Do your comprehensive health every year. Even if possible, do it every six months to know the state of your health. So by doing this, you remain healthy. Your family, you remain healthy. Your family too will remain healthy, and the whole community too will remain healthy. And this will, in other words, reduce the mortality rates of people in the community and the state at large.
Thank you so very much, DDNS, Bilikis, Anifowoshe. This is a very beautiful way to sign out. I am sorry I didn't take all of those calls. It's a very beautiful way to sign out from the studio this afternoon. My name remains the same, Adebambo Opayemi. I want to say thank you to Dr. Ireti Dada, the Principal Medical Officer. Thank you so very much for coming around today, ma. Thank you so very much. We hope to see more of you some other time. Yes. And of course, thank you to pharmacist Omolade, Adekola. Thank you for coming around, ma.
Thank you very much.
I don't understand. I've not seen my own vest, but okay. I would say that after the show. Let's do it again, same time tomorrow. My name still remains the same. You already know Adebambo Okpayemi. And of course, a very big special thanks to Ikorodu General Hospital as we have tackled health and health-seeking behavior of people in our rapidly growing community. Today, remember to take care of yourself. They say health is wealth. Eat good food, sleep well, clean your environment, and ensure you look like our beautiful mothers here, even though they are aged and yet they are looking so young. It's a bye for now. Let's do it again tomorrow. God bless Nigeria. God bless Lagos. God bless the beautiful people in Ikorodu.
Thank you.